Hello, I'm Mark Donnelly. I'm going to explain the DOAC AF tool. So the data that you've pasted from EMISOL System 1 will go into this section under this blue header. So date of last medication review will be the last row of data that goes in. We can see that there's some areas here that are highlighted in red, which I'll come back to. The next section, this is for apixaban. So the next section are the 4 areas that are that contribute to a reduction in dose. So we've got age, weight, serum creatinine, creatinine clearance. So where there is something that contributes to that, there is a risk factor. It will be highlighted in red. So you can see this patient here is 80. So that's a risk factor that's highlighted in red. All the other ones are below 80, so they're in grey, and so on and so forth for the other risk factors. Then it works out if there's 2 or more risk factors, then the dose should be reduced to 2.5. So it works out the creatinine clearance, works out the creatinine clearance, and then works out the theoretical dose according to SPC, and then puts that in this column. In the next column, it's got the dose that the patient is actually prescribed. Then it compares those together to say, well, if they match, then the dose is correct as per SPC. If it's not, then we've got so you can filter that yes or no. You've also got a column for underdosed and a column for overdosed according to SPC, a column for weight, column for if creatinine clearance is under 15, and whether to consider warfarin there. This column here works out whether the patient should be on 12 or 6 monthly monitoring based on their creatinine clearance. And then this one here tells you whether their monitoring is in date within that 6 or 12 months. And the last one is whether the medication review has been done in the last 12 months. So there's a few, we've got a note section there if you wanted to just make a few notes on the patients if they've been reviewed. So a few things to go through. As I say, there is a filter on every column. Over here we can see that this is highlighting in red because there's no weight for this patient, and it's highlighting in red that there's no serum creatinine for this patient. Sometimes the weights aren't pulled through for various reasons. They're recorded by an LCH nurse. I've noticed before they're not always recorded and pulled through from system 1. So if you can go back to the system and find a weight for that patient, you can enter that there. So this patient, let's say 65 kilograms. That's now updated the weight risk factor, and it's not highlighted that as a risk because they're over 60 kilograms. So that's corrected that, but we've still got serum creatinine. So let's say we've done the serum creatinine, and rather than running it and then exporting the data again, we've run it. We know we've run it, and it's 100. So type it in the wrong place. So it's 100. So we enter that there. The sheet has then got all the information it needs to work out what dose that patient should be on. So we can see that the theoretical dose is 5 milligrams. The patient is on 5 milligrams, so the dose is correct. So that's fine. So that's been sorted out. So the other thing to look out for with weights is sometimes if a weight's been entered with a question mark, then the Excel sheet won't recognize it. So that those would need picking out. Show how easy it is to see it. There's a lot of weights there. The other issue is the weights entered incorrectly. So there we are. So I've just sorted that large to smallest, and you can see that there's one there that's around 92, squiggle 92. So, but if you entered that correctly, then that will then work out the weight, so that's fine. This one here, we've got someone at 725 kilograms. I think that'd be a bit surprisingly heavy, so that's probably been entered incorrectly. It might be 72.5. So that's something else to look out for. So if we go back to the, that as well. If we go back over here, so we can filter for dose correct or incorrect. So incorrect, we'll highlight all those that are incorrect. Then you can just filter the ones that are underdosed or overdosed. Obviously, if they're underdosed, they're not going to be overdosed. Then it allows you to see here, for example, with apixaban. So these patients that were on, the theoretical dose is 5, but they're on 2.5. If you look across, we can see here that all these patients here, the only risk factors they've got is their age. And actually this one here doesn't have any risk factors, so there's no reason at all why they should not be on 5. So it's very easy to see where the incorrect doses are, and identify where the problems are with those doses.